Good afternoon, everybody. Thank you so much for joining us today. My name is Meredith Mendoza-Gillett. I am with the Ohio Department of Developmental Disabilities, and I so appreciate everybody being here today to join us for our last Family Advisory Council meeting for 2024. So I'll go ahead and get started, and we have a very full agenda today. I did want to let everybody know a few housekeeping things before we get started. We are using Zoom today. If you need the captions, there is an icon that can be selected. Alternately, there is also ASL interpreters available for us. They will be spotlighted and visible throughout the presentation. And if you're able to see in the chat, we will also share information for a special link if you need to have captions as well from our card captionist. Please remain muted when you're not speaking. We encourage everybody to use video, and please be advised that today's session is being recorded. By participating in this event, photos and videos will be recorded and you will be included in future recordings associated with this meeting. They will be posted on our website at a later time. Our agenda today includes the Office of Compliance, OhioISP updates from the Department of, our Medicaid health system administrator, community life engagement, and some updates for family. At the end of our session, we will have some time with our leadership as well. So what is Family Advisory Council? Why do we host these meetings? This is a time for families to learn about changes that impact and support your lives, as well as share experiences with leaders at DODD by engaging in conversation.
Hey, Meredith, can you let people in? I think we have people waiting to come in that haven't been allowed in, and it's not allowing me access to do so.
I apologize. Thank you so much. Okay. Thank you so much, Corey, for letting me know. Hearing from families does help us with shaping policy, and receiving the feedback helps us with developing resources as well. So the intent of this time is for DODD to hear firsthand from folks across the state regarding issues that affect Ohioans, and allows an opportunity for everybody to share their experiences. If there is a particular concern specific to your services and support, those will be handled on an individual basis. I wanted to share a few terms that are used commonly throughout our system, and these can be available for everybody to see. So to start our conversation, I'm going to hand it over to Lisa Burt, Assistant Deputy Director of the Office of Compliance.
Well, good afternoon, everyone. As she mentioned, my name is Lisa Burt, and I work in the Office of Compliance. I wanted to be here today to provide a bit of information for all of you about the work that we do. We often are kind of behind the scenes, and we work with county boards, we work with provider agencies, and our goal, our main two focuses, is to ensure a qualified pool of providers are available to provide services to persons and their families. We also are there to confirm that the county board processes support person-centered assessment, planning, and monitoring monitoring of I'm going to say the words, home and community-based waiver services. So we'll go to the next slide. So this just gives you a brief overview of where our staff are located. We follow what's called the superintendent's regions, and we have staff that manage each of the areas. In our office, we have Jenny Saxton and Vanessa Prather. They do the sanctions work. We have in Region 1 and 2, Angel Morgan and Tina Haggerty. In Region 3, Mandy Brooks and Tina Haggerty. So you can see that some of the staff are repeated because they manage more than one region. We have Mandy Brooks and Katie Willie in Region 4. And in 5 and 6, we have Julie Gregg and Katie Willie. So that's a lot of the state that these staff cover. Our staff are located, our reviewers are located throughout the state, from the Cleveland area to the Cincinnati area. We have folks in Region 5. So you can see that we're sorted throughout the state of Ohio. Next slide. Now, the work that we do when we review a county board, we call it an accreditation review. And basically, we review county board processes. There's a word missing on the second bullet where it says it occurs and it's prior to the expiration of the previous county board term. We include visits to the county boards and their locations. We interview individuals and families and guardians at either their home or day services programs. And to be clear with the visits, they're voluntary. People can say, no, I'd rather not talk with you. You're a stranger, I don't know you. Or sometimes families are really engaged and really want to have a conversation with our staff to talk about the services and supports that they receive. We review plenty of documentation. We do observation of service delivery, and we provide technical assistance, which is one of our favorite things to do, which is to help people do what they do better. For providers, and these are certified providers, and they're also providers that are in licensed facilities. We review all of the certified and licensed facility providers. We review the ISP. We interview families and individuals and guardians. We do observation, which is our opportunity to see how they implement the services that they're providing. We review personnel and training records, service documentation, and then again, our favorite, technical assistance. Now, typically when we're doing this review process, we're not really anyone's favorite folks, because they feel like they're going through a test. But what we're doing really is trying to determine if what they're providing is in compliance, and if it's not, we may issue a citation. Now, a citation is not a negative thing. It's simply something that needs to be corrected. And if a provider or a county board needs assistance and to provide that corrective action, we support them with other people in the department, and we ask them to help the provider or the county board to come into compliance. And we do that pretty regularly. If anyone has questions or concerns, we encourage them to visit some of our sites and use some of our resources that we have online. Excellent. So where you guys might interact with some of our staff is when we do the individual interviews and or family or guardian interviews. And I wanted to share with you some of the questions that we ask. For example, do you know your SSA? There have been a lot of changes in our service system where we have a lot of new SSAs, and sometimes people have a concern, but they're not sure who their SSA is. So if they share that with us, we'll follow up so that that person can get to know their SSA right away. and we give that feedback to the county board. Do you like the services you receive? Sometimes people thought they wanted to do an activity, they really don't like it, and they wanted things to change. And we wanted to make sure that they understood that the SSA can help with that, the provider can help with that. Um, and so we ask those questions and we provide the feedback to the provider or the county board. And typically we don't use names unless the person is okay with that. We also check to see if people can decorate their home the way they would like. Can they access food at any time? Were they able to choose their roommate or housemates? And we've had a few people say, man, I really don't like that guy. We just do not get along. And so we just share that feedback because maybe that was the first time they were asked that specific question, or maybe that was the first time they were able to share how they felt about it. And we want others to know that they're not satisfied with the way things are. We also ask about accessing activities in the community, whether people are able to get out, worship in the ways that they choose, um, be able to visit friends and family, have activities of everyday life that they enjoy that would make their life better. So we ask those questions, and if we find that there are some areas that need improvement, we share that with the provider and the county board. We want to make sure that folks are getting the supports and services in the way they want, the way they like it, within the boundaries of the service delivery system. Sorry, I'm having a little trouble here. All right, so I wanted to share again that we have resources online. For example, all of our tools are online that we use. We have ones for county boards, we have ones for providers, independent providers, and those that provide what we call ancillary services like counseling, social work, some folks that do modifications, home mods, and those kinds of things. I'm sorry, home modifications. So we also have a mailbox. When people have questions, this mailbox is covered daily. Um, if you have questions, generally, you can send a question to us to ask about a specific part of the service system or just about the services that you're receiving. And if we don't have the answer or we're not the right person to answer that question, we will make sure it gets to the right person. We treat this mailbox like a no wrong door. And then lastly, you'll have my email address should you have some questions or concerns about either services or your interactions in the service delivery system that caused you any concern. And we'll be happy to have that discussion with you, whether it be myself or someone in our office who would follow up with you and try to get answers to the questions that you have. Now, today I took a really high level view of compliance. We do a lot of work in technical assistance, question answering when people have those, and we want to be a resource to anyone in our system. My personal motivation about public service is that we do the best job that we can, that we're transparent and we're open. Um, and sometimes when we are looking at a system and if we're incorrect, we try to make those adjustments and changes. So I'm pleased that you guys allowed me to be here. I hope to join you more often. Thanks, Meredith.
Thank you so much, Lisa. I so appreciate your time and giving us an overview of the services and how your team can support families across Ohio. I would like to open up the floor if anybody has any questions for Lisa about her team and her work and how we can support you. And I'll ask Corey if you can be my eyes on the screen as well, because I'm not able to see everybody. If you see in the chat also, Corey was kind enough to put some links in there for some resources that Lisa has shared. and the emails as well. Nate, I see your hand up.
Let me switch audio. So 1 second. Can you hear me okay? Sorry about that. Does anybody else have a question? Because I only want to go if no one else is raising their hand.
I do, Nate, but you go ahead first.
Oh, no, it's totally fine, but thank you. My question for Lisa is, a lot of folks will sometimes have trouble evaluating how services are going. And I'm wondering if you have any suggestions based on the questions that you have and ask and the tools that you use that might be able to help people and families think about how services are going, and maybe if they're happy with how things are going or if they need to change how things are going.
So when we're having conversations with individuals and families, sometimes we're talking about what's going on now, but we also try to ask people to think about the things that they want. We don't stay the same throughout our life. We change when we grow. And when I'm talking to someone, if I can zero in on a particular area of interest, if a person has a cooking goal and I go, do you like that? I mean, I cook at home because I like to eat, but I, I don't actually like cooking. Have you ever taken a class or have you ever taken something in the community? Is that something that you're interested in? And so we talk about that. I also encourage individuals and families to keep a notebook. That notebook is, you should fill it up with questions that you have, maybe you had in passing or a thought you wanted to share, because that'll help you when you're ready to sit down for your next meeting or your next meeting with your SSA or anyone that's a service provider. And if you have that notebook handy, you can thumb through it and see what kind of questions or concerns that have come up over time.
That's a great
Thank
tip,
you.
Lisa. Thank you. Amy Austin, I know you have a question.
Yep. Hi, thank you. Hi, Lisa. Thanks for the presentation today. When we get calls, I work with Ohio Family to Family, by the way, so I support families who have children and youth with disabilities all the time throughout the week. When families don't know how to set up their shared living paperwork, such as daily tasks that they are providing for their loved one. How do they know where to get support, or is this slide where I can share with them
Yes, ma'am.
exactly where to go?
You can go to the compliance, which takes you to our section of the department's website. And there, if you click on the resources, you can see that we have some examples of documentation forms, because that's what people get stuck on a lot of times, is really trying to figure out from the ISP, what goals do I need to include? And so first we encourage them to talk locally, talk with the SSA and say, hey, this is what I pulled out from the form. Can you take a look? And sometimes the county also has someone they call a provider liaison. And that's a person who supports providers in the community. So a shared living family is a shared living provider. And so they can rely on them as well. But often, because we want to make sure that everybody is doing what they need to correctly, we posted some example forms online. And we're happy to talk someone through whatever is needed.
Thank you. Very helpful.
Oh, you're very welcome. And if you look at our tools, they'll also tell you what we're looking for. Okay, we want people to do this with the A++. So we're trying to make sure that we communicate. We also do regular trainings throughout the year where we talk about different topics, personal funds, documentation, training, those kinds of things. And we do those throughout the year. And so those are also shared on the website. And I'll make sure I get the link for that as well.
Perfect. Thanks.
You're very welcome.
Great information. And we always learn something new in these presentations. So thank you so much, Lisa.
Absolutely.
Corey, do you see any other questions? I don't see anything in the chat right now. So I appreciate your time and joining us, Lisa. So thank you so much. I'm going to go ahead and move right along to our next presentation, and that is Beth Chambers, our Ohio ISP manager.
Hello, everyone. Thank you so much for letting me have a few minutes of your time today. I'm Beth Chambers. I'm the statewide Ohio ISP manager. And I wanted to start with my team supports the standardized plan in Ohio, which I'll talk a little bit about. But it's also, it's about person-centered planning. It's about assessing, planning, monitoring, just that checking in, revising as necessary, and that ongoing communication to and from, and the person and the family is at the center of that. And I just wanted to acknowledge, I know Lisa Burt did a great job sharing some information, and I think it's important to talk about how the areas of the department are connected. My team works very closely with Lisa because what she's seeing in compliance says a lot about what we might need to identify as training needs or support in our system around planning. So I just wanted to make those connections, that we do have regular conversations to see how what we put into policy is actually being implemented and where are some of the areas that might need some support within our system. So I just wanted to start with that. Thank you, Lisa. Meredith. Again, just wanted to talk about Ohio ISP. It is the standardized plan in Ohio. It ensures that there's one plan for all Ohioans. Same plan format, same process. Ohio ISP content is individualized. So standardized template allows us to put the good stuff about the person and make them come to life within this plan, really represent who they are and what they want. It includes an online system available to teams, and it allows the plan to follow the person served. So it allows for transfers. If someone's moving from county to county or from an intermediate care facility to home in the community, and they've moved to, now they're enrolled in a waiver. So it allows that flexibility that when I move, someone already knows kind of where to find things in a plan. It takes away some of that guesswork. We went from having, there are 88 different counties, so 88 different formats. We have our intermediate care facilities, which had hundreds of different templates. So really just kind of leveling that playing field, like what is the planning template? And then really focusing on how do we make that really come to life for each person? It's going to look different, and it should look different. And then Ohio ISP can be used for anyone, but it's required for people receiving home and community-based services on that waiver, and then people living in ICFs, the intermediate care facilities. The rule states that they must have had an Ohio ISP in the online system by June 30th, 2024. We extended kind of the parameters around that to say that no compliance citations will be issued for plans not in the online system until January 1, 2025. Want to stop a little bit. It turns out that people have needed a lot of support in getting those plans transmitted. So we know that not everyone will be in the system by January 1, 2025. So that'll kind of change what I'm going to talk to you about next. But knowing that that is what we want. The DoD online system will be the source of truth. It will be where plans are housed. But right now, your planning process will still be handled at the county board level. You will still experience the assessment, the planning, all of that, the way the county board has done previously. So it's really that your role in the assessment process should look very similar. The way you've gotten plans should look very similar. We will talk a lot about what that support can look like and what accessing those plans in the system once we get closer to that 100% transmission. But really looking at that county board and that local level to show, like, what are you experiencing right now? Where is that county at in the transmission process? How will you be participating in the planning? How will you be receiving your plan? I know we've talked a lot about, making sure that everyone's up to date on what is being asked, what is being expected. So really just wanted to hone in on those dates, and that we'll get into a little bit more detail, but that we know that we really are trying to work. My team is working with people every day to really up those numbers of transmission, work out any glitches. We've developed a lot of, we have webinars for different users and really trying to see what the needs are to develop some trainings and different types of support. Next slide. Want to go back to OhioISP. We know that we really can't emphasize this enough, that OhioISP is OhioISP, and it includes 3 distinct components. It's the introduction page and the plan, and then the assessment. So I think next slide goes into what that looks like. In the introduction page, we've been using that for a long time. And it really is how any of us would want to be introduced, how we would introduce a family member or a friend, and that what would we need to know at a glance to, like, it doesn't substitute for the whole entire plan, but it's also those highlights. What is really important? What is important to the person and for the person? It also can include fun pictures and, pictures that tell the person's story if that's how they choose to fill that page, so that people at a glance can kind of get the essence of who they are. And then the assessment, that's the ongoing learning through casual conversation with the person, their family, discovering what the person needs and wants, understanding their strengths and abilities, identifying any risks, and then kind of like talking about ways to mitigate that. And then what's important to the person and for the person. And really it's that ongoing learning about, we learn all the time. Hopefully we're never not learning new things about people. And then the plan, that's what everyone is agreeing to. That is what drives the assessment drives the plan. The plan is the what has been prioritized, what people are agreeing to deliver, who's delivering it, and how it will be delivered. And it's really what that person and their family is agreeing to. So that plan portion is really the meat of, this is what's been prioritized, this is what we're going to be working on, and this is what we've agreed to implement. Thank you. And then again, I can't emphasize enough the importance of reaching out to your SSA or the QIDP for information on what to expect, timelines for transitioning to OhioISP, just really any questions you have about what this means. What should I expect? What should I be looking for? How will I get my plan? Will things look different? And then really looking at if you have questions, it really is about, if you have questions about specific planning process pieces or practices, really talking about that at that local level, because that's still going to be whatever process people have been using, the ways that you access your plan, the person that's going to be able to help you the most with that is that plan author, that person that's supporting you. Okay, and then this just goes into a little bit more detail. What will you experience when transitioning to OhioISP? You'll still be involved in the assessment and planning. This whole process was developed in part to empower team members and to really engage people at different parts of the conversation, to really know what to expect in kind of the areas of the assessment. How do we want to make people aware of what questions are going to be asked? You'll sign off on the completed plan if in agreement. There's still a dissenting opinion portion. So if you don't agree, really work that out. The whole point is to really talk it through and make sure that you're coming to agreement and that we're all on the same page on what the expectations are about the plan. And then once plans are finalized and have been uploaded into the DoDD system, information will also be able to be accessed there at the point where the plan's transmitted. So right now you could have an account set up, and if the county board has not transmitted that plan yet, or the ICF, you won't be able to see that in the system. So it really is, that's why I keep emphasizing the local level and those conversations with your SSA, the QIDP, so that you're really having those conversations about what's going to look different, if anything. If you have questions about any piece of the planning process, they will be able to answer that. And again, team process has not changed with this. If anything, we want people to be more involved, more engaged, very transparent. So the way you receive plans or access to plans will vary based on the county board or the intermediate care facility and where they are in their implementation plan. So where they are with transmitting plans into the system. And I just want people to be aware that there are ways to enter the plans. Salesforce is DoDD's system. They can enter plans directly into Salesforce, or some are using a software vendor. So those plan components and requirements are the same. That in order for it to transmit to our system, there have to be those requirements met, those validations. But they're entered in to the vendor system and then transmitted to DoDD's system, Salesforce. So the vendors right now are Britco, Primary Solutions, and I see Amy Clausen. I just want to give a shout out. I know it took us a minute to connect after our last meeting, but I really appreciated you taking the time to just kind of share with me some of the things that you were experiencing. And Amy just said, hey, can we FaceTime? Like, can I show you what I'm talking about and what I'm looking at? And it really helped me put into perspective. There were things that as a system we could do better and enhancements that we could make. But some of the things you talked about were, you admitted they weren't the biggest things, but they're annoying. Like, can we at least look at this? If you ever get to change this, could we do it? And one of the things Amy mentioned was that the order of the ISP in the Britco system was confusing. And I reached out to our contacts at Britco, and they said that's going to be addressed in our next update. So just wanted to bring home that we are really trying to listen and hear what you're saying, what you're experiencing. I know we're not going to address every single item as soon as you would like us to, but we are gathering that and really trying to see where we can make the user experience better and really make that communication as transparent as possible. And then I just listed out some resources. There are a lot of resources on our webpage. There's also a team map. I mentioned my team. They're supporting, they're really focusing on SSAs and Qs right now, really helping them get the planning down, answering questions about using the OhioISP template, and transmitting plans. They're working with county boards and intermediate care facilities.
Thank you so much, Beth. That was a lot of really great information. And I know your team is doing some tremendous work taking over hundreds of plans and making it one standardized template, but really focusing on a person-centered plan is really, that's a tremendous feat. So thank you for what you're doing. And also thank you, Amy, for bringing up your questions last quarter. And I'm glad that you and Beth were able to connect so that she could really dig in and improve the process. So thank you. I know that there are some things in chat. So go ahead, Corey.
Sorry, I had to find the unmute. Thank you. One of the questions that we have here in the chat is the online system available to include individuals and family members as part of the team?
Yes, I wanted to make sure I was unmuted. Yes, so there is absolutely, the person in the family is considered that team member. There, what we're talking about today is, unless a plan has been transmitted into the system, there won't be anything to see in that yet. But yes, to answer the question, yes, that is definitely part of the process. Once the plan is transmitted, it will be housed in the DoD online system. Thank you.
And just to add, Heidi, to Beth's comment, so the team process at the local level, you should be seeing the Ohio ISP prior to like a signature and approval. So it won't come to us at the department until the person and their family and their teams have worked through the assessment and moving it into the plan. And so once it's finalized, that's when it comes into the Department of Developmental Disabilities system. And so we get it after everything's happened at the local level. And then once it gets uploaded in our system, just like Beth said, that's when a family member or a person can actually get into our system to see it. We are still sitting at a close to around 56% completion of plans being sent to us. And so once we get that at a higher percentage, we will do some statewide training on how people can get into the system and access it. We're waiting to get to that percentage at a higher amount because we don't want people to start getting in and their plan has not been actually uploaded. So that percentage, we're working really hard with our county boards and ICFs across the state to get their plans in. So, but it has been designed to do that. It all should be happening at that local level before it gets sent to us. But again, once it's done, then you also can access it through our system as well. So I just wanted to add that. Thanks, Beth.
Thanks.
Thank you.
You're welcome.
Thank you, Stacy. And Stacy is one of our assistant deputy directors. So thank you for sharing and giving us some insight. I do see that somebody has their hand up. So I'm gonna take this question, and then after this question, we'll go on. So thank you, Dantes.
Thank you all. Thank you, Lisa. Thank you, Beth. The information has been amazing here. I am actually going to be submitting my application today or tomorrow with the Packard agency. So all this stuff is very, very new to me, but I'm learning some of the terms that I took in my course. I guess my question is, what obstacles should I be ready to expect as a new agency in this field?
That's a great question, and there can be a very long answer, but the first thing we have to do is get your application in. You have to get it completed, and that goes through our certification department. Once you have submitted everything that you need to, they'll take it from there. They may ask you some questions, but as a provider, what you really want to understand is the service that you agree to provide and that you're documenting according to the ISP, and that you're supporting people in the way that they would like to be supported. Those are the two most critical features that we see. But go to our website. You can see our review tool. You can see the provider resource section, and I added that to the chat. Go through that, and if you have questions, again, you want to start with your local county board to make sure you check in with them and ask them a lot of those questions, because they'll be quite helpful with you knowing the folks that they serve.
Perfect. Thank you so much, Lisa.
You're very welcome.
Hi, my name is Ann Wysant. I am the DSP and Provider Support Manager for the Department of Developmental Disabilities. And I just wanted to introduce myself and congratulate you on again, the process and starting the process to become a provider. Our team, in collaboration with the provider liaisons, provider support staff at the local county boards, are available to help prepare new providers to be successful. So if you have any questions or you want to reach out to us, I'm putting my email address in the chat. Please feel free to reach out, and we'll connect you with one of our provider support specialists or with the county board staff who can assist you.
I appreciate that so much, and thank you.
Absolutely.
Thank you so much, Ann. And Ann will be joining us next quarter to talk more about DSP information. So I'm glad you were here, Ann. Thank you so much for that. I am going to, I do see that there are some other questions, but I do need to move along. because we have a pretty packed schedule today. So I want to give everybody some time to share all of the important information. So again, Beth, thank you so much. And thank you for the work that you do every day for people and getting their services.
Thank you.
I'm going to pass this over to Amanda Robinson from our Medicaid department, our Medicaid health system administrator, so she can share some information about our waitlist assessment, waiver waitlist assessment updates.
Good afternoon, everybody. Thank you for having me. I wanted to come and talk about our waiver waitlist assessment rule update. We had some changes effective November 1st, and I wanted to give you a quick overview of the things that we updated within that rule, and then also, important areas that we changed in our waiting list assessment rule to provide more clarification for county boards, people that we're serving, their guardians and family members around the process of administering our waitlist tool. And we wanted to clearly identify a timeline for the administration of the tool. And we updated some definitions that we use within the rule. And I believe Corey has my one pager. Corey, do you have that to stick on the screen for me? Okay, while I'm waiting for Corey, we've been doing one pager updates for the field for the past 2 years. When we have updates to our rules, whether it be for services, in this case, our waiting list assessment, we complete these quick visuals of what the updates were so that people are aware of what to look for that has changed within the rule. And I'm going to, Meredith, do I have access to put the one pager on the screen?
I just dropped the link in the chat and you can share your screen. I apologize.
That's okay. Now I have to remember where it's at on Zoom. It's been a while.
No worries.
All right. Can everyone see it? No. Okay. How about now? My screen changed. So, okay, yes. We're good to go. Great. All right. So updates that we had to our waiting list assessment rule. One of the definitions that we updated was the community-based alternative services. So we wanted to include that these services must be available and likely to meet a person's needs. And we added some examples of what community-based alternative services are. And they include mental health agency, public children's services, and family and children first counsel. So we updated that definition. And then we wanted to give further clarification around when to administer a waiting list assessment. So anytime a person, their guardian, or a family member requests the county board to administer the wait list assessment. So if you go to the county board and you say, we would like a waiting list assessment, that triggers the county board to start that process. Anytime a person requests to be enrolled on a home and community-based waiver, or if they say they want to be placed on the waiting list, that's definitely another trigger to say, yes, county board, we're going to start this waiting list assessment. And then finally, anytime a person, guardian, or family member identifies an unmet need, if they're coming to the county board and they're saying, I need help, we have this need, then the county board should start that waiting list assessment process. Also, we wanted to bring to light that a waiting list assessment will be re-administered when the person, guardian, or family member identifies any changes in circumstances that may result in having a current or immediate need. So anytime you have changes in your circumstances, even if you've had an initial waiting list assessment completed, you want to go to your service and support administrator or the county board and say, we've had some changes in circumstances. We would like to talk about some needs that we've identified. And then that waiting list assessment will be reviewed and readministered. Another area that we updated quite a bit is we added a timeline for completing the waiting list assessment. So we added that the waiting list assessment will be initiated by doing an interview within 15 days of the date of the request or identification. So if you're going to your county board and you're saying, I have a need, I want a waiting list assessment, I want a waiver, the county board has 15 calendar days to complete that interview with you. Once your interview is completed, then the county board will complete the waiting list assessment within 45 days of the interview. So that gives them the opportunity to look at the needs that were identified, make sure that they're exploring alternative resources, making sure that they have all of the areas of the need identified. And if there are alternative resources, they're matching those up. And they have 45 days to complete that waiting list assessment. Once they've completed it, then the county board will notify the person, their guardian and family member, of the outcome within 10 calendar days of the completion. Anytime the timeline is not completed in this way, we want county boards to document any extenuating circumstances related to the individual if there's a delay in interview or completion of the tool. So if for some reason we know things happen, illness, holidays, vacations, life gets flipped upside down sometimes. So we want to make sure that in the event that the person has extenuating circumstances, the county board can identify that, make note of it, and reschedule with the person, guardian, and family. Let me scroll down just a bit, and I'll tell you some information about your notification of the outcome and what that should include. So your waiting list assessment's complete. And once it's complete, the county board has 10 days to notify you in writing of the outcome. And we want to make sure that that notification has a few specific details. So when they're notifying you in writing, the following information must be present. So we want to make sure they're giving you a copy of the completed waiting list assessment tool and explanation of your due process rights. We also want to make sure that if it's determined that community alternative services will meet the person's needs, we want them to provide you a list of the assessed needs. We also want them to give you specific community-based alternative services that address each of those needs. We want them to provide you with a date that the county board's going to follow up with the person and their family to determine if the services have been accessed. So if they're giving you community alternative resources, they're going to give you some time to reach out. You can always reach out to your SSA and say, I need help accessing these services. And so we want to make sure that there's a specific date where they're going to follow up with you to make sure that the alternative resources have been accessed. And at that point, you can also tell them that you need assistance if you haven't been able to access those services. We also want them to provide you contact information for the service and support administrator who will assist in accessing those community-based alternative services. So giving you a name, an email address, a phone number, ways of connecting with that SSA is really important so that if you need them during this point of accessing those community alternative resources, you're able to reach out to them. We also added a little bit of information about when to give due process. Due process is the opportunity for right to state hearing, and a county board must give due process when it takes action of placement on, denial of placement on, or removal from the waiting list. We wanted to add some information about the county board will issue and explain due process to the person, guardian, and family member. We hear often that due process forms are given, but families don't really understand what they mean. They don't understand how to turn those in for a state hearing or where to turn those in. And so we want to make sure that the county board is explaining to families what it means and who you can connect with or who you can turn those forms into in order to request a state hearing. And those were all of our updates to our waiting list assessment rule. Those were effective November 1st. So county boards are currently utilizing the timelines and the notification and the additions to due process.
Chatting away and I was on mute. Thank you so much, Amanda, for sharing. This is a lot of great information. I do see that Corey dropped a link in the chat for where this information can be found on our website.
Perfect.
And if you would like to stop sharing your screen, we can see if other folks have questions, any hands raised or anything like that.
Did I stop sharing?
No.
This is what I get for only being on Teams. Let's see.
Quick question. If no one else does.
Yes.
When you say the county has 15 calendar days to do an interview, does that have to be done by phone or in person? Or, you know, like some counties just call and say hello to the family to get the lay of the land? Or how official is the family being informed about the official interview?
So that initial phone call should be about scheduling the interview. We really want families to have the opportunity to sit down. And when we talk about the interview, we're talking about going through the questions on the waiting list assessment and really understanding what the needs are. And so the 15 calendar days is we want that phone call to happen and we want that interview scheduled within 15 days of the family notifying or the person notifying that they want a waiting list assessment, that they have an unmet need, that it's identified that that assessment is needed.
Okay, thank you. I think some of our families are getting confused on, oh, well, they called me and they said they already know what our needs probably are, you know, kind of a thing. And I am encouraging families to ask the person who calls them to ask more questions. You know, what is this? What are we going to be doing? You know, so that the family speaks up, number one, and that the family is more informed, number two.
I agree. And I think it's a really important piece. And hopefully this is something that supports county boards in understanding what the interview is, that it is a conversation going through those questions and identifying the needs with the family, with the person that they're supporting. So if you're hearing of those things, or if you have specifics, you know, you can always reach out to me or to Nyoka Cradoff. I know Amy, you talk to her sometimes when you come across families and situations. So by all means, reach out to us.
Thank you.
So then I would also like to hand it off. Meredith, did you say that I was handing it off to Jolene Carlson now, our policy manager, to go over some waiver changes that are going to be effective January of 2025? Miss Jolene?
Thank you, Amanda. I was going to just let you keep going. Thank you guys for letting me have a few moments here to review some pending waiver changes for 2025. Our plan is to have all of these stand up January 1st of 2025. Everything is at CMS, the Centers for Medicare and Medicaid Services, who approve our waivers. And we are waiting for their approval of all of these items. So just to kind of let you know that we're talking about things, we've got resources out there, but nothing is official until it's official from CMS. The first thing I want to talk about is a brand new service called Healthcare Assessment. This service is available in all 3 of our home and community-based services waivers. So that's the IO, the level 1, and the self. And this is a monthly subscription service. It's our first one of a monthly subscription type service. And the healthcare assessment provides a real-time health assessment to determine the best clinical course of action and help avoid unnecessary emergency room visits for individuals. This is a real-time virtual consultation provided by a physician, a physician's assistant, or an advanced practice nurse to assist an individual and or the individual's authorized caregivers to understand the individual's presenting health symptoms and identify the appropriate next steps. If an emergency room visit is required, the provider of healthcare assessment will coordinate with the emergency room and prepare them for the person's arrival. And hopefully that individual will maybe not need to wait as long. The healthcare assessment service is an offshoot of the Station MD pilot project that has been going on that began in February of 2022. And this was a way to, really to help folks avoid unnecessary emergency room trips, individuals who may not have had access to after hours care through their primary care physicians, situations where, maybe a group of individuals living together and there might be one staff. And if somebody needs to go to the emergency room, unfortunately, maybe everybody would need to go to the emergency room, or the person taking the individual is the backup coverage and may not know the person as well or the symptoms that have been presented. This is not a service to replace your primary care physician, and it is certainly not a substitute for 911. Obviously we want to stress that. So if anybody's in an emergent situation, you want to, use your 911 option there. At this time, there is one provider who has applied to become the healthcare assessment provider, and that certification is currently pending. Our hope, obviously, is that once we get approval from CMS for this service to commence on January 1st, that provider certification will also be able to commence January 1st as well. So if this is a service that somebody is interested in, you're going to want to reach out to your SSA and talk about a person's assessed need for the service. Following the the use of the service or your call to the healthcare assessment provider, they will also, whether they have suggested you go to the emergency room or have required or offered another set of treatment options, they will follow up with you after that process just to assure that everything is going smoothly and that your primary care physician has been made aware of what transpired. The next service that has been updated for January of 2025 is an addition of a special rate for our non-medical transportation service. Non-medical transportation currently transports individuals to specific places. It's adult day support, vocab, group employment, some volunteer activities, as well as competitive integrated employment. Through some of the work with the Blueprint group and feedback from stakeholders, we had a number of individuals specific to community integrated employment or competitive integrated employment that were having difficulty finding non-medical transportation to and from their job. Maybe this was because of the hours that the person was working, or that it was farther away than perhaps somebody would typically go to a, adult day support program or vocab program. So a special rate was created for individuals. This is a per trip rate, and it is a one-on-one service, because what we heard is these were sort of one-off situations for individuals who are having trouble getting to work. And it's a per trip rate, but it is based on a mileage band. So there's a few depending on whether you're going 0 to 15 miles, 16 to 30, and then 31 plus miles, there is a rate. And then that rate is also enhanced if you are an individual who may require a modified vehicle. So all of that is, and again, the definition of competitive integrated employment has been added to the non-medical transportation rule, as well as it is a part of the employment first rule. So it is really a specific, it's not for, the enhanced rate is not for adult day support or community activities from your day program, but specifically for that group of people who have competitive integrated employment. The other update to the non-medical transportation rule was that we did update the definition of commercial transportation to include an entity that transports passengers in accordance with a published usual and customary fare schedule and is either a bus or rail system or an on-demand taxi cab. So we just made some clarifications to the rule there. And then the final update that we made was to the Environmental Accessibility Adaptation Service. We often call this home modifications, but the official name for the service is Environmental Accessibility Adaptations. And CMS had asked us to sort of update our language a little bit. We have always had a $10,000 cap per project under environmental accessibility adaptations. The cap remains, however, CMS wanted us to put some language in the waiver amendment, which we did, and also added to the rule, what to do if that home modification should be over $10,000, and we would need to assure someone's health and welfare. So there's some language that just addresses the DODD, the county board, and the team collaborating and making some working together to see how we can get something secured for an individual when the cost of that item might be more than $10,000. I have just dropped, unless Corey already did, and my apologies, the link to the website, the January 2025 changes. On that link on our website, you will find some PowerPoint slides. There may be some frequently asked questions. There are just sort of one-pagers where we kind of highlight some of the changes. And then certainly any questions that anybody has, feel free to reach out to Waiver Policy TA at dodd.ohio.gov. And I'm saying it slowly because I'm typing it in the chat. And so if you have any questions, certainly feel free to ask or send specific questions there if anyone has them. And I think that was everything I had.
That was what I had also on my agenda, and that's a lot. Thank you so much. There's a lot of great changes happening, and thank you for spending your time and sharing with us. I know that there has been some conversation in chat, and I believe those questions have been responded to. So thank you to everybody that's jumping. But thank you. So I am going to move right along because we are a little short on time. I appreciate being here, and I'm going to pass this over to, excuse me, Keith Banner, our Community Life Engagement Project Lead.
Great. If you want to, yeah, there you go. I'm Keith Banner. I'm the project lead for Community Life Engagement. We cover a lot of territory on my team, but I wanted to focus in on 3 projects that are kind of really interesting, and hopefully you'll find them interesting. The Adult Day Support Quality Pilot we established at last year, October 2023, and it's basically a capacity building project to support day programming providers to increase the quality of their services. Through this pilot with 99 providers, both all different sizes, small, medium, and large providers across the state in all regions, we are investing in technology to improve efficiency of the service. We're investing in staff time and training, and then also investing in establishing a quality manager position for each of those agencies that oversees training, and also how they're working toward improving the quality based on a measure set we've established that we will be paying them to an value-based way around measures around staff training and retention, supporting people with complex needs if they're doing that well, and increasing the numbers of folks with complex needs, skill building curriculums if they're using them, and then also a quality measure around experiences, the people they're supporting experiences toward an outcome. So all that funding and all that attention is basically to kind of increase the quality of that service and develop standards that we can share across the field to all adult day support providers, so that by the end of the project, we'll have a lot of really good information to kind of hopefully increase the quality of the service all over the state. The next thing I want to talk about is the Blueprint for Adult Day and Employment Services Work Group. Basically, the Adult Day Support Quality Pilot I just talked about came from this group, which was established in January of 2020. They worked all the way through May 2021, and the group was comprised of family reps, people with lived experience, providers, county boards, and external partners, basically all coming together to kind of focus in on day and employment-related supports and transportation services. And so they spent a lot of time talking through a future state of where services during the day and transportation services are where they need to get to in the future. So basically, they established proposals around increasing the quality of adult day, like I just talked about, or also increasing the quality of services and employment. They were able to kind of really build a lot of really good improvements into the system. Now they supported a creation of a new self-directed transportation service, and also that non-medical transportation to competitive integrated employment that Jolynn just went through. A lot of development of statewide training specific to transition from school to adulthood, and establishing multi-agency planning teams in 30 county boards across the state. Also leaning into research on how to use services available in the traditional Medicaid services to bridge potential gaps. And then also establishing an employment services readiness project to fund training and capacity opportunities for employment services providers in the waiver. There's a lot more stuff that was accomplished through this great group that, again, offered up their proposal in May 2021, and we've been working through that proposal until the fall of this year, 2024. And at that link, you can find the final report, which walks you through all the great accomplishments of the group, and also the future of what we're going to plan to do based on the proposals and the work that's already happened. And then thirdly, I wanted to walk us through the Transformative Technology grantees. We had 6 grantees doing 7 projects around this Transformative Technology grant, which was basically to support better health outcomes and service quality across the state for people with developmental disabilities. And 3 of the projects are of interest, I hope, to you all, but all of them really are interesting, but these 3 might pique your interest. There's one from the organization called Intellectability, which is basically a curriculum that supports clinicians who are interested in supporting people with disabilities. And so basically it's an online training certification process that supports nurses and doctors and other clinicians to kind of build their capacity and knowledge around supporting people with developmental disabilities. It's called the Curriculum in IDD Healthcare. And I'm going to put in the chat, if you're interested maybe in referring someone or a doctor or someone you know, you can get the information and also get a contact at Intellectability there. Another really interesting project through the Transformative Grant is Right Care Now project, which was founded by Dr. Susan Aben. And it's all about making healthcare more accessible and effective for people. This team they created, Lucid Health Support System is the team. They created an innovative tool called the Right Care Now project, which basically empowers caregivers, direct support professionals, families to kind of have all the information for the people they're supporting in one space, one place, so that they can take it with them, and it makes the information kind of all make sense, and that can communicate it to the doctor quickly, so that when you make a doctor's visit or an ER visit, you'll have that on hand and easily easily communicated. And that's called the Right Care Now project. And I can put the link for that in chat too, if you're interested in discovering more information about that. And I just put that in chat for you. And then the third project I wanted to tell you about finally is ITI, Assistive Technologies, which is an organization that is building a new app called Decide that uses artificial intelligence to help adults with autism make decisions more easily when they feel overwhelmed by choices. And it's designed basically really for anyone who finds decision-making tiring or gets stuck when trying to make choices. And so ITI is building this up now and is sharing what they're learning in a statewide webinar coming up, I think early next year. But right now they're just kind of piloting it. And if you have any interest around this Decide app, you can reach out to me, and I can kind of connect you to the folks that could help you be a part of that initial project there. So those are my 3 projects I wanted to tell you about. And I think, yeah, that's basically the end of my little presentation. I appreciate your time.
Thank you so much. I maybe able to have one question, but I love all of these projects that your team is working on. Hearing about Right Care Now, it's going to be really exciting for families to have all the information in one space. So thank you so much. And thank you for sharing your email and all of those other great resources. Awesome. So really quickly, before we jump into our time with our leadership and directors, I did want to give some very quick updates for families about our ways that we're going to engage next year. So for many years, this meeting, it's a public meeting. It's been called Family Advisory Council, and we are going to have the same format, but just a different name. So really this name is to capture the direction and how we want to engage with everybody. So it's the Family Connection Forum. I have the dates set up here, and there is a link. It'll be easier next year to just have one link. And thank you, Corey, for dropping that in the chat. You can access all of those dates and sign up for our meetings next year. So with that, these meetings are, we spend a lot of time as a leadership and internal team, and we also work with a very special group. We call them the core group, and we're currently accepting applications for what we're calling the Community Connection Core Group. So the Community Connection Core Group, what they do is we lean on these really important folks to give us feedback, give information. They help us with driving resources and guiding these meetings. So the ideas, the topics, the questions, they come from the folks who participate. So it's not just families, it's also people living with disabilities. And I encourage folks to put in their application. We will have applications open until January 10th. So thank you, Corey, for dropping me the link in the chat also for that. There's a few other ways that you can connect with us outside of this meeting, subscribing to our newsletters, listening to my colleague Nathan Turner as he guides the DOTD podcast, a lot of great information there. And with all of that information, I want to turn it over to Director Howe. We are so thankful, Director, for your time that you've taken out of your schedule. And I want to have the director as well as our leadership answer questions. I did want to ask our director and our leadership just for a really quick update on some of our ARPA projects. And then from there, we can talk about other questions that folks have. This time together is to hear about specific topics that impact people and personal questions or more specific questions. We want to really dedicate the appropriate time. So we will take those questions offline and respond at a later time. So Director Houck.
Thank you, Meredith, and thanks for having me. I just want to start by saying I'm going to apologize up front. I have a cough and I've got a cough drop in my mouth. So if you hear that, I apologize, but I'm going to try to not cough all over this afternoon. But yeah, so, you know, I don't know if Steve or someone else has a better ARPA update than I do, but I can tell you that we've been so lucky to have these funds and be able to, you know, get those out the door to providers, county boards, family organizations. We have been able to support some really big projects around accessibility. And so one of those being the changing tables across the state. You know, this is such an example of families advocacy working. They're two moms, Jennifer and Kim, who have been working on this for years to get additional changing tables across the state. And we're really excited that in our last state budget, as well as some ARPA funds, money was dedicated specifically to that purpose. And we think we, as a state, have invested more money in that than any other state. So we're really excited about that. ODOT, our Ohio Department of Transportation, will be renovating or building new rest stops along the freeways, and they will add 28 universal changing tables to those rest stops across the state. So we're really, really excited about that. A couple other things that happened in the last budget, and I'm going to do this quick because really I'm here to hear from you all. But we were able to get additional funds for people who are dependent on ventilators. So we have an add-on for people who live in an ICF, and we were able to get more money. So children and adults who are currently in the hospital and not able to leave the hospital because they don't have a place to go, we're able to increase the funding for that. And we've seen, I think, 10 additional people just since the budget was passed, be able to move out of a hospital and into a more appropriate setting because of that. So we're really excited about that. And then, of course, another one, I hope you've all heard about this, the governor and the legislature passed an additional $1.3 billion into our system to help with rate increases. So that went to shared living providers, family providers, you know, everyone who's providing homemaker personal care, or other services to people with disabilities. So our DSP wages have gone from an average of $13 when the governor came in to about $17 today. And we expect to see those go to somewhere between $18 and $19 this year. So we're really, really excited about that. I'm not sure if everyone on this call knows how the budget process works, but we did submit our initial budget to the Office of Budget Management. We call them OBM. Back on October 21st. And, we've been having conversations with them all along. And we also will meet with the governor's office to really explain what our services look like and, what we'd like to see in this upcoming budget. The governor will release his budget sometime the beginning of February. We expect it to be before, around the 2nd or the 3rd. And once he does that, then our department is really able to start talking about the budget and what you should expect to see in the budget. So, we're just waiting for about another month and a half or so before we can really start talking about the details, and during that time, you all can be advocating for what, you'd like to see in the budget. You all did such a fabulous job in the last budget, writing letters and giving testimony to what you thought was most important in that budget. So we will schedule calls, and we'll certainly send out written messages and all of that once we, are really able to, after the budget is introduced by the governor. So I just wanted to give you that quick kind of overview of the process and kind of where we're at. Excuse me, I'm sorry. So again, this is a time for you to really ask your questions, and I know we don't have much time now, Meredith, so I apologize for that, but or if there are things that you would like me to know that are kind of happening out there.
Thank you. Anytime that we can spend with you is always appreciated. So we appreciate it. He did mention also some things that were part of the ARPA projects, the Adult Day Services Quality Pilot and the Transformative Tech Grants. So yeah, so that was additional information.
And I also just want to say, obviously, this isn't the only time that we want to hear from you. You can always send us emails or give us calls. That's what we're all here for.
Thank you. I did see Amy Cleffin had a question about acute care services. So if you want to go ahead and unmute and ask your question, Amy.
Yeah, sure. Hi, Kim. Hi, everybody. Thank you again for this meeting. It's been highly informative. Love the new resources. I wasn't sure where this question would insert, so I just put it in the chat so that in case if you didn't have time. But a few parents who have mainly adults with very complicated medical needs are trying to access the acute care services that are and it seems like there's just a lot.
Amy, you're cutting out a little bit and we're not able to hear you.
Okay, can you hear me now?
Yeah. Amy, I'm sorry, we can't hear you, but Jolyn,
okay.
Your camera came on, so were you gonna?
Yeah, we do have, Amy, some information, frequently asked questions, and a sort of webinar PowerPoint. If you are able to have those families, or if you have specific information you want to reach out to us about, we certainly have been working with county boards as we get forms in and questions come up. but we can definitely, work through a specific situation if you can get us some details, and you can send that to waiverpolicyta@dodd.ohio.gov.
Okay, I will do that. Two specific families I am working with now
Okay.
are, ranging from their SSAs had no idea about the option. The adult child was in the hospital several days, needed lots of help communicating with hospital staff. There's when you're in that situation of urgent hospital need, you make a request for the acute care and you're hoping that the family and the person doesn't have a lag time, you see.
Sure.
So that's the issue, is that the families need more than, a month later getting it into the pause. So I think the whole reason around the acute care service is to help the person right now while they're in the hospital, correct? So I think the sense of urgency is just not there yet. So that will help. I'll shoot them both an email and have them reach out.
Sure, we're happy to work through any issues.
Thank you.
And Amy, I did see in the chat too, we have received that as feedback as a different way to approach that with OhioISP and some of the prompts, and maybe not as a specific question, but some of the guidance around that. So we do have that logged also. So thank you.
As a future change on the list.
Something to consider.
Yeah.
Yes.
Okay. Awesome.
Thank you.
Thank you.
Thanks, Amy. Well, again, I just want to make sure everyone knows, you can reach the department anytime, and we're here to support you. And, thanks for inviting me to be a part of these meetings. They're super informative.
Thank you for taking time to share your time and everybody's expertise. I really appreciate all the leadership. I appreciate the families for taking time out of their very busy schedules as well to share and to, I know it's difficult to navigate a lot of different things, and being brave to pose your questions as well. So it's very appreciated. I'm looking forward to seeing everybody in the upcoming year. I have a list of questions to follow up on here, and I look forward to having a great holiday, and hope you guys do too. Thank you all so much. Have a great afternoon.
Happy holidays.
Thank you, everybody.
Everyone.
Thank you.
Thank you.